Parenting is an art. Usually, when we choose an art to pursue, we spend months, years learning it, practicing it, perfecting it. But being a parent, we are simply thrust into the war room and expected to master this difficult art instantaneously. Every child is difficult. Every situation presents a different challenge. Today, I am here to help you, to give you some tips on some important and common problems which parents face. Disciplining a child in today's age is a Herculean task. A naughty, hyperactive, disobedient child throwing a temper tantrum is every parent's worst nightmare. Most parents simply punish this child and call it discipline. This punishment at the hands of a frustrated adult can be harsh and demeaning for the child, and it makes him think more about the punishment rather than what wrong he has committed. What is required is disciplinary action and not punishment. This should be well thought of, planned and intimated to the child. It should never be harsh, it should never humiliate the child, and it should make the child think of what wrong he has committed. One of these ways to enforce discipline is to give the child a timeout. Depending on the child's age, so a 2-year-old child can be given 2 to 3 minutes of timeout, a 5-year-old child 5 to 10 minutes. Timeout also may mean time out from his favorite activities like watching TV. Another way of disciplining the child is to make him give up something which he owns, something which belongs to him, and give it to someone else. A third way is to give the child a task which requires some effort, such as cleaning up or taking care of the plants, something which is demanding but not boring. Say, the parent of your child's friend comes up to you and says that your child has hit their child. A common reaction of a parent is to give a small slap to your own child. Or if you have gone out shopping and your child is throwing a temper tantrum saying that I want to buy this particular item, most parents would scream at the child back and humiliate the child in a public space. This is not correct. What needs to be done is that you should intimate your child कि the next time he does that, the punishment would be so and so. Instead, the right way of dealing with such a situation is to forewarn your child the next time such kind of a thing happens, his TV privileges will be taken away, or he will miss his favorite chocolate treat every Sunday. Habits, good or bad, developed in childhood continue till adulthood. A child is like a piece of clay. He or she can be molded in any way that you want. It is our duty as a parent to try to inculcate good habits in our children. How often it happens that a parent comes to us and says that my child doesn't sleep early in the night. When I ask them, what time do you sleep? The answer is that I sleep late. Remember, your child will learn what you do and not what you say. A child will get 6 to 8 episodes of viral infection every year. Most of these are associated with fever. Remember, fever is your body's reaction. Fever is something which your body produces to fight an infection. The height of fever has little to do with the cause of fever. A child who has high fever and is active, I'm not worried about such a child. On the other hand, a child with mild fever who's looking dull, I'm more concerned about such a child. Fever does not harm you. One exception to this is a neonate, a newborn with fever. Any fever in a child less than 3 months of age, that child I would be concerned about. Some children between the age of 6 months to 6 years develop convulsions or fits in response to fever. Reducing fevers in these children to prevent any further episode of convulsion is important. The first step to reduce fever in your child is to give a dose of paracetamol. Please document your child's fever because that will tell you whether the child's fever is increasing or reducing. This will enable us to decide whether any investigations are required. It is common practice amongst parents to give cold compresses to their children at the time of fever. This practice is no longer recommended. Suppose your child's fever does not respond to all medications. Sometimes tepid sponging or sponging with room temperature water is recommended. So parents, remember, do not panic if your child has fever, even if it is high fever and your child is active. Worry about the cause of fever.